President Biden says every American who wants a COVID-19 vaccine will be able to get one by the end of July. And he made those comments during a town hall event in Milwaukee last night. The president's chief medical advisor, Dr. Anthony Fauci, at one point had said it could happen as early as April. He appeared on CBS this morning where he addressed the change in that timeline.
What has happened is that the doses that we were expecting earlier from the J&J likely will not be available for another couple of months after that. The ultimate total amount of doses that J&J will get us, we're pretty confident that we're going to get the 100 million doses by the end of June, the beginning of July. And I believe that's the reason why when the president was saying available by July, it was in tune with the fact that we will get those doses that we were promised, and I'm sure we'll get them by that time. So I think the dates now coincide pretty well.
So joining us now is Dr. Neeta Ogden. She's an internal medicine specialist and immunologist. So thank you so much for joining us, Doctor. During that town hall meeting, the president also said that he expects the nation will be much better off by September. I mean, it's sort of a vague term, much better off. I hope that we would be much better off by September, but how realistic is that goal?
Well, good morning. I think that it is a realistic goal. I think what we're seeing right now is that this frantic pace of vaccine rollout has had a few hiccups, specifically the Johnson & Johnson vaccine. You know, we've been hearing about it for quite some time. It still hasn't gotten that emergency use authorization expected to come at the end of this month. So the FDA is taking its time reviewing data. And then it also saw some snags and production delays. We originally heard that by the end of February, we'd have 12 million doses of the Johnson & Johnson vaccine. And as you just reported, that's now been pushed back to April. But what we are hearing consistently, and I actually laud Dr. Fauci and the administration for being pretty honest and transparent about these types of delays. And at the same time, I think that they are being very clear that we are going to see a significant bump up in the spring into the early summer. And I think between that, more vaccine availability at that point, less vaccine hesitancy, I think a realistic, time frame is end of summer, early fall, where we're in a place where many people have gotten the vaccine, and we've really kind of overcome these initial hurdles.
But, the other point, I think, Dr. Ogden, is that when we think about getting back to normal, I suspect that most people imagine the world pre-2020, like, 2019, when we weren't thinking about this at all. But even after all the Americans who want to be vaccinated are vaccinated, we're still going to have this virus will still be out there. And even if you've been vaccinated, doesn't necessarily mean, just like you can be vaccinated against the flu, you can still get the flu even after having received the vaccine, right? So I just wonder if life will really never get back to what we call normal. We'll always at some points have to wear masks, and we will perhaps need yearly inoculations against this. What does your expertise tell you?
Yeah, Vlad, I think you're definitely right. I think there's some even psychological PTSD from this experience that we've been through. Will people continue to wear masks simply because they're afraid of what could lie ahead? And with these variants, we know that as long as the coronavirus exists, it can mutate and it can create these strains that leaves us vulnerable. And in the absence of, vaccines that are addressing those exact strains, and I know that the science is definitely working on that right now, I think there will be some hesitancy to just go right back into the way we were in 2019 until we have more information of what the landscape of not just the virus is like, but how many people in our country have been vaccinated, who's still left vulnerable. Is there asymptomatic spread after you're vaccinated? Still a lot of unanswered questions, and we don't even have vaccines for children, right? So a big part of getting back to normal is schools being reopened. We're hearing so much in the news about the CDC's new recommendations, and not all of it feels really doable. So we're talking about schools in the fall. I just think that you're absolutely accurate that it's going to take quite some time before everyone being even when everybody is vaccinated, for us to get to the point where we feel like we're normal. We need a few more things in place. For example, medications that are available when you have mild coronavirus or when you're initially diagnosed, or prophylactic medicines, just like we do for the flu vaccine. We need more testing, rapid testing like we have for the flu vaccine. These are the kind of steps that we need to see in place along with the vaccine I believe, for us to feel confident to go back to that pre-pandemic phase.
I, for one, have enjoyed not having strangers breathe on me, and I don't think I want to go back to that, to tell you the honest to goodness truth. But, Doctor, you brought up something that a lot of parents are talking about, which is getting the kids back to school, and Joe Biden was asked about that at the town hall as well. He said that he wanted to see, by the end of his 100 days, he wanted to see K through 8 kids back in school 5 days a week. But then there's this other thing sort of hanging over that. It's the teachers. In most cases, teachers are not high up on a list to get vaccinated, and so that's going to have to change. Teachers need to get vaccinated as well, or maybe they don't. Doctor, what's your take on it to get kids back in the classroom?
The CDC's guidelines really laid out some very specific mitigation efforts, and they're quite extensive. Just listing them makes it seem maybe somewhat doable, that we need universal masking, we need disinfection, we need better air quality. Some experts weigh in that that's just, opening more windows. We need screening, but beyond that, we need to know what kind of infrastructure does a school have in place if there's, for example, a positive case at school. Do they have places to isolate, to quarantine? Do they have the physical space to, create the 3 to 6 feet of distance between students? So there's all of that, because the CDC is saying, well, we can get the schools reopened and the teachers don't need to be vaccinated if we have all these mitigation efforts in place. But frankly, let's face it, much of the country doesn't have, they're going to need, a lot of resources to execute this. And there's also, their recommendation that schools shouldn't reopen when there's high community transmission. Well, 90% of the country is still seeing high transmission, even though we're seeing declining numbers. So, the other side of that debate is, should teachers get vaccinated? They're saying no. If we have mitigation efforts, all teachers don't need it. But many of these schools are saying, well, we don't have the resources quick enough to do all these steps. The best bet around that is to vaccinate our teachers and staff. And, I think we're going to end up somewhere in the middle. I do believe that teachers should be higher up on the priority list if we want to start moving closer to normal. And that means getting kids back to school to create that safety net, because many teachers are hesitant because they're worried about infection. And when the CDC is saying, no, schools indeed, and studies have shown schools are very safe when the right steps are put in place. But it does take a lot of effort and resources to make those happen. And some experts say it's just universal masking alone can achieve that. But, there are a lot of pieces to this puzzle, and I understand why there's hesitancy from teachers. They don't want to be part of necessarily an experiment, and the vaccine would give that cushion of security as we safely reopen schools.
So Britain is moving forward with plans to expose volunteers to the coronavirus in an effort to advance medical research into the pandemic. It's the first country in the world which plans to do this sort of human challenge study. Can this be done in a safe, controlled environment?
Yeah, I think there's a lot of debate about whether this is ethical. People have brought it up from the beginning of when vaccines were coming out. And the UK is saying that safety is, the utmost concern here. They're looking at healthy volunteers between the ages of 18 and 30. They're going to be under very controlled circumstances. To be honest, this is something that's been used in the investigation of other vaccines and infections. So I think under the right circumstances, it could give us very valuable information about how the virus works, how, the infection works, what kind of inoculum, what's the smallest amount that we need to get infected, and then also the real data that we continue to look for right now is even potentially how the vaccines work against different variants.
Yeah, it is really sort of interesting, Dr. Ogden, and it'll be interesting to see what results come from those tests in the UK. Dr. Neeta Ogden, always great to have you. Thank you.
Thanks for having me.